Hi everyone, thanks so much for having me today. Really excited to speak with you. So a tiny bit about me in addition to the introduction. So I'm Aimee, I've got an MSc in Behaviour Change. So I started working for Dogs Trust about 2 years ago, and essentially what the work that I do is I incorporate a human behaviour change approach and methodology into all the interventions, can you hear me, that we deliver. So just getting into the presentation. So a little bit about who we are before getting into the main bulk of the presentation. So we are the largest dog welfare charity within the UK. Last year, we rehomed 8,000 dogs and helped a further 10,000. So our goal, like many of us here today, are to see all dogs living full, safe, and happy lives free from pain. So at Dogs Trust, the way that we do this is to recognise that we need to work with people as well as dogs to promote canine welfare. And as I'm sure a lot of you know, that is easier said than done. So a human behaviour change approach, what is it? So it's a whole methodology. I could speak about it for hours. There's courses on it. There's resources, both free and paid for. But I've tried to sum up essentially what it is within 3 key steps that we follow. So the first of those steps is to discover what the problem is without prescribing a solution, and to always base your research and to use evidence-based in your approach. So essentially, what does this mean? This means try and avoid using assumptions, 1, about what we think the problem is, and 2, what we think the solution is. It always involves asking ourselves, why? So a lot of the times in the meetings that I'm in with my team, we are constantly just asking that back to each other again and again. So second is to use theories, models, and evidence to inform how our interventions are built. So again, avoiding using our own assumptions, maybe our own biases, and actually trying to embed what we do in evidence. And then the third, it's been said before, but it's measure, measure, measure. So not only to be able to measure the impact of our work, but also to continuously add to this evidence base. So getting into dog bites. So when we approach the issue of dog bites, it is a huge and quite daunting problem to try and solve. It's a global problem, and it's a problem that we have in the UK. So UK evidence says that about 25% of people in some studies report that they've been bitten by a dog. Similar figures are found globally. They obviously differ depending on the contexts. So it's a huge, huge issue. Sorry, I forgot to use the clicker. Oh, there we go. Aha. There we go. So essentially, it's a huge problem, and it can be quite difficult to narrow down the change that we want to see at an individual level. So how do we do this? So at Dogs Trust, we use evidence to inform what the problem is. So when we're looking at this issue of dog bites, it can be huge. It involves various behavioural contexts. So dog bites that happen to delivery workers, for example, in the home, is completely different to dog bites that happen in public spaces. So if we want to tackle the problem, if we want to measure it, if we want to deliver tailored solutions to actually deal with that specific problem, we need to be specific. So where does this leave us in terms of finding out which problem was our top priority? So evidence tells us that dog bites to children, there's been a lot of talk about this within the previous presentations, but dog bites to children essentially are some of the most severe dog bites that happen, mainly because the children are more likely to be close to the ground and just be more in contact with dogs, so they're more likely to get bit in the face and the neck. Also, evidence tells us that 91% of dog bites happen in the home with a known dog. This is evidence from the UK. This will differ globally. But essentially what that tells us is that this is a common myth that we need to overcome, that unknown dogs is the biggest risk. So this leaves us with the problem that we'll talk about today, which is preventing dog bites to children in the home with a known dog. So a lot more achievable than just dog bites. So we come up with, okay, so we've got our problem. How are we actually going to go around and actually try and change this? So the first is to try and engage with the right people. How do we know who the right people are? It can be quite an assumption to say, okay, well, it's dog bites to children. We're just going to focus on children. It's something that we've all done. I know that I've done it. And it's definitely something that can be tackled through what we call systems thinking. So I know it's going to be really, really blurry. It's a really big document. If anybody wants to see it, I've got my laptop. I'm more than happy to show you. But essentially, what a systems thinking is and a systems approach is about documenting the problem in a holistic way. So this essentially means mapping out all the actors that are involved in the problem beyond just children and beyond just dogs. So this is caregivers, vets, anybody that has any impact on this. It can be schools, it can be teachers, anybody. So with that being said, one of our main audiences that we did first try and tackle is children. So children and the behaviours that they perform are mapped out on the blue in the map that you should be able to see. I know it's blurry. So that introduced us to BDog Smart. So BDog Smart, I wanted to talk about today just to introduce you to our journey that we've gone through with education. So a few years ago, BDog Smart started as a primary sort of dog welfare education in schools. It was really successful, it had great engagement. However, the purpose of this education program was to teach about proper dog welfare, how to take care of your dog, and how to be a good dog owner. And that's all well and good, and it was a great program. The only issue is that we were teaching children to perform behaviors that they themselves, as children, would never perform. So children themselves, in their child state, would never be dog owners, and they would never, hopefully, engage in a lot of those behaviors or have responsibility for them. So we went back to the drawing board and we recognized, okay, let's make some changes and let's actually teach children how to perform the behaviors that they will actually need to perform. And that's when the program became more of a dog bite prevention program. It was a lot more directed and it was a lot more effective. However, recently, very recently, so I don't have any stats or anything like that on it, but essentially we recognize that we can do better. So we are currently going through a process of incorporating theory within our approach and to make sure that it has more of a behavioral focus. So these impact measures are essentially from the previous program, so we're hoping to even have a better effect size later. But essentially what we found that a single workshop had a significant effect on changing pre and post. However, we recognized that we were measuring knowledge and attitudes. This doesn't actually measure behavior. The new program will essentially look at repeat visits to assess whether we're actually changing behavior. Again, it's in the drawing board. Hopefully next time I'll be able to, if I come back, talk to you about that program, and hopefully that will be successful as well. So back to the systems map. We're doing some work with children and it's going great and it's being really effective. However, we came back to the systems map and thought, well, we've got this whole map of actors that we know are contributing to the program, to the problem. You know, we used evidence to inform this. We conducted our own primary research. We know that they're having an effect. And what are we doing in these other areas? So in the really blurry orange, what you can see is there's a huge part of the systems map, even bigger than the behaviors performed by children. And these are the behaviors that are performed by adults and caregivers. So I'm sure this isn't surprising to a lot of you, if you're parents or just have any involvement in education, that modeling and engaging with these behaviors is really impactful on the children themselves. So we knew that we needed to do something around parents and caregivers. So introducing a new intervention that we needed to prioritize. So essentially, the systems map was really useful in achieving this. So we looked at the systems map and we essentially measured which behaviors would be most impactful. So this led us to 3 key target behaviors for our new intervention. So the first was to stay close, watch and listen during child-dog interactions. So essentially what the evidence shows is that active supervision, being close and proximal during interactions, is really, really important. Unfortunately, it's something that not a lot of people do and not a lot of people know about. So this was really important. The staying close was the most important component of this. So if a parent is in the room but is on the opposite side, they're distracted, and something happens, they may as well not be there. They're not going to be able to intervene. So the second related behavior is to step in and intervene if you see anything unsafe. The third, again related, is to separate if anyone needs space or you are preoccupied. So it's about being preemptive if you know you're going to have guests over or you need to dip out the house or something like that, maybe using a baby gate, whatever your approach is. So essentially, our next step was, okay, we've got our target behaviors, we know what we're trying to tackle, actually, we don't know too much about this problem. So the next step involved us doing some primary research. We were very fortunate to be able to do this. If in other situations we could have used secondary data, I'm sure a lot of you are aware in animal research, in comparison to other sectors, this is sometimes lacking. So our data was vast. I've tried to synthesize it into one slide. But essentially what we found was over 80% of respondents reported always or sometimes leaving their child and dog alone together. So we knew this was a problem we needed to tackle. Secondly, and I think the most interestingly, parents and caregivers can't identify the correct cues to action. So essentially what this means is it's twofold. So it's one, that they would identify behaviors performed by the dog, quite severe behaviors, as cues to action. So these would be things like growling or lip licking. They wouldn't identify those lower cues. There were some responses, I looked through them, there were thousands, it was a sample of about 3,000. You had some responses that say, I wouldn't intervene unless they bit my child. So really, really severe. We'd hope that that would be way, before that. But most interestingly, what we found is that parents and caregivers did not identify behaviors performed by the children as cues to action. They would only wait until the dog responded to actually intervene. So this we knew was something we really needed to tackle. And then probably unsurprisingly, they were unable to identify dog body language. So this was quite unsurprising. We've done a lot of research on this. Dog owners, unfortunately, are actually worse than non-dog owners at recognizing body language, so it's a consistent theme. So we have another barrier as well related to too many barriers. So essentially this was a really key thing within the research as well. So what we found is people reported there are just too many barriers to close supervision. People are busy, people have competing time demands, people have other priorities. It's not included on this slide, but I think one of the most traumatizing things that came out of that research, we asked, can dogs feel things such as pain, worry, and fear? So bear in mind, we're asking dog owners these questions, dog owners with children. And over 60% of people reported that they did not think that was accurate. So actually, the problem was a lot more severe than we realized. This was in the UK as well. So the next step, we found that, okay, we've got a lot of this evidence. How do we actually use it and action it? So the next step for us, I'm not sure if anyone's familiar, but it was a step called audience segmentation. So essentially what this involves is getting a big data set and then deciding, okay, I want to segment this audience based on one key factor. So we segmented it based on the level of supervision. And then we found that based on people who supervise less and people who supervise more, what are their characteristics? So for the men in the room, I'm sorry, the two key priority target audiences, they are men because men were found in the research to supervise less. So we call them our uninformed Ians and our busy Bens because both of them, they're quite similar. They lack understanding of dog behavior. They work full-time, they're busy, and they lack general education. We have our secondary target audience, which is our empathetic Eva and present Pam, which were less of a focus because they are engaging in some supervision. So I just wanted to briefly introduce you to the theory that we used to design this intervention. So essentially, this is a theory called the health belief model. It's taken from the health sector. It's used really successfully there. And because, again, this is sort of a public health issue, it was really relevant to use it here as well. So in really simple terms, what the theory says is that people need to engage in these key constructs, and if you change those, you'll change behavior. So people, to change behavior, need to feel that they are personally susceptible to this problem. This was a huge thing from the research that came out, that people think that their own dog is not at risk of biting. And, we know that this is completely the opposite. 91% of dog bites happen to children in the UK, in the home, in their own environment with their own dog. So we knew this was a huge myth that we needed to change. They need to believe that this could be severe and have severe outcomes. They need to feel confident in actually performing supervision. They need to believe that supervision is effective, and they need to not think that there are too many barriers to supervision. So I'll introduce you to some of the strategies that we used essentially within the intervention. So unsurprisingly, the first is education. So we knew from some of the barriers that I've mentioned that there were a lot of barriers related to education. We really need to focus on the risks with unsupervised child-dog interactions. We really needed to emphasize that any dog can bite, including your own familiar dog. However, for us, we recognize that there were multiple barriers for this target population, as you could see before. Education for us could only overcome barriers related to knowledge. So if there was barriers related to other things like capability or opportunity, education was not going to be enough. One of my favorite studies is sort of related to this. It was a study of smoking cessation. I think I've mentioned it to a few people that I've spoken to. And essentially what they did is they showed smokers images of, the really vivid images on cigarette packages. And what they found after that is that smokers actually increased their smoking behaviors post-exposure, and they decreased their intentions to stop smoking. So there's two reasons for this. One reason they call the ostrich effect, and essentially what this means is that people tend to just stick their head in the ground. They don't engage, they completely go off and don't listen to anything you're saying. And the other, which I think is slightly more interesting, is that it's called what I call the over-justification effect. So what that is basically is it forces people to confront. Well, actually, it forces them to try and think, to over-rationalize. So people might think, oh, my grandma smoked since she was young until she was 90, and she was fine. So it forces people to think those thoughts, and then that decreases their intentions to stop. So we know that educating people, sometimes people are reluctant to that education. So we incorporated some other strategies. So one of them was modelling. So modelling was really important for our Ben and Ians. Ben and Ian were often underrepresented within our charity, being men. They engage with us less. So we knew that we needed to model some behaviour using familiar others. So we used images and videos, and we made sure to be as diverse as possible. So probably most importantly, other than education, is training. So training is often lumped in with education, but it is very different. So training goes further than education, and it actually tries to provide people with that additional support that they can have. So we knew that this was really important, especially for our Ben and Ian personas. They did not have the ability to recognize body language. They did not recognize what the cues were for action. So essentially our strategy for this, as you can see, it's to book live masterclasses online. They were completely free, and it was all about how to read and understand your dog's body language, how to create routines and habits so that this is a continuous behavior that people perform long term. And then some other supplementary things that we included. So overcoming barriers was a huge one as well. So the way that we achieved this, essentially in research, it shows that action plans are really, really useful for this sort of thing. So we have free action plans that we provide to people. We help them write them in the masterclass as well. So we prompt people to identify and to predict what their barriers might be, and then to create their own solutions to overcoming that. And then lastly, persuasion. So again, really similar to education, but we just pull it out and separate it to make sure that we're incorporating it correctly. So we make sure that we use persuasion, persuasive language, persuasive images. So things like 91% of dog bites to children happen in the home with a dog they know. We really wanted to emphasize this and really wanted to persuade people and motivate people to act. So again, I introduced you to this model earlier. I just wanted to include this here to state that this was the model that we used to design the intervention, and therefore it's also the model we used to measure. So this is really important for us. We want to make sure that, even using evidence, we are using assumptions of what we think is correct. That is what a theory is. It's an assumption. It's a theory of behavior. So we wanted to measure essentially whether this was correct in this behavioral context. So as you can see, we've got some of the extracts of some of the questions that we asked people pre and post. This is an ongoing pre and post study, so I don't have any specific impact measures for this. Hopefully I will soon, but it seems to have really great engagement so far. So just a quick summary. So problems are complex and have a lot of interrelated factors. So I think the key main thing that we incorporate that's been really useful and something that we've used sort of quite recently is that systems thinking. It's been really, really transformative for us. It makes sure that we're looking at the real root of the issue, rather than just sort of ascribing solutions to top-level things. It makes sure that we're understanding what system we're looking at. So when I talked about things like the over-justification effect, for example, that would be mapped onto the systems map. We'd make sure that if we thought that was going to have an impact, that would be mapped onto our intervention. Each behavioural context has its own set of behavioural barriers and facilitators. So this is just sort of addressing that. We were looking at a really specific problem. You know, dog bites for us was way too general. It incorporates way too many sort of diverse barriers. We need to be specific. Have a framework to inform intervention design. Again, this is something that we use within every intervention, and it's really, really useful. And then to adopt behaviour change methods which suits your organisations. So we get a lot of people coming to us asking, how do I incorporate behaviour change? It can be really difficult if you don't have that structure within an organisation. So my advice would just be to look for the projects in which there is opportunity to incorporate and to use those as your sort of gateway. It can be really frustrating to try and expect immediate change, but it's about finding those opportunities and going from there. So that's it from me. Thank you.